So let's go back to the acutely infected people. And let's say they had acute symptoms, they recognize they just had a tick bite, they got tested, even though negative, but they've been diagnosed with Lyme disease. What do they expect to be treated?
It really depends upon whether you're ill and you have active sickness or whether you think you were exposed because you had a tick bite. So the first kind of questions I ask when people call up in a panic saying that they had a tick bite, I say, well, number one, what kind of tick was it? Was it attached? Was it hard to pull off? Was there that white cement plug around the mouth parts? Did you leave any of the parts in? Had the tick started to engorge, which is the process of getting bigger as it sucks blood? Has there been any reaction at the bite site? Is it red? Is it itchy? Is it sore? Is there any kind of ulcer-like thing? So that's helpful. If people think they were exposed just because they had a tick bite and they don't seem to have many symptoms, then I think they should send the tick for evaluation. There are several labs that do that, but one here in Pennsylvania up in Strasburg University is at tickcheck.com. So that's tickcheck.com. And their turnaround time is about 30 hours. So you can get that pretty quickly. And what they do is they look at the contents of the gut of the tick. And well, they grind the tick up and then look for the genetic sequences of the different organisms. And they'll tell you, did it have Borrelia? Did it have Babesia? Did it have Bartonella? Did it have Ehrlichia? Did it have Anaplasma? Did it have Rocky Mountain Spotted Fever? So they'll tell you, and there are different tests that you can, panels that you can ask. It's not terribly expensive at all. So that's very helpful, because why would you want to put yourself through a treatment if the tick was completely clean? So I always ask people to try to remember to keep the tick, put it in a plastic bag with a little bit of a moist cotton ball or a moist paper towel, put it in the refrigerator, and then send it off to be checked. For acute tick bites, when it's within the first day of the bite, I use a homeopathic medicine called Ledum palustra at a 1 m or 1 million dilution. What it does is it helps the immune system push out the infectious agents in the foreign bodies that aren't self, that are at that bite site. So Ledum has been traditionally used for any kind of puncture wound, anything that punctures through the skin. The Ledum palustra is used in homeopathy to help clear whatever toxins or infections or dirt or grit is in that. So it kind of wakes up the immune system function right at that spot where the bite is, where the entry into the body is, and then pushes it out. And I have people continue that until the bite site's healed. That could be 3 days, that could be 7 days, it could be 10 days. Then if anyone develops any really suspicious symptoms, then they must get treatment, and must get treatment as soon as possible. Because if caught early, Lyme disease can be cured. But if these infections are not treated early and they spread deep into the body, they can become chronic and very difficult to eradicate. So if you're actively ill after a tick bite, generally most doctors will use regular allopathic antibiotics, meaning regular Western pharmaceutical medicine. I would suggest that in the event of an acute bite where you're ill, I would take both a cell wall antibiotic, which would be either a penicillin derivative like amoxicillin, or a cephalosporin like cefuroxime or Ceftin or Suprax or brand names, as well as a second intracellular antibiotic. And the best really is doxycycline, because doxycycline will kill the Anaplasma, the Ehrlichia, and the Rocky Mountain Spotted Fever. So the combination of 2 antibiotics, if you're ill, for at least 4 to 6 weeks. And the reason it's that long is because the life cycle of Borrelia burgdorferi is at least 4 weeks, sometimes longer. So that means that it takes 4 to 6 weeks to actually kill all of the organisms that are there, because they can only be killed as they're actively growing, the way the antibiotics work. Taking 10 days of doxycycline, 100 milligrams twice a day, is totally inadequate, and drives the Borrelia deeper into the body, making it very hard to get rid of. That was shown by Eva Sappi from the University of New Haven in vitro, meaning in the laboratory, in culture, cell culture studies, showing that doxycycline caused the Borrelia to just like curl up in a ball and make this biofilm and just hide and only killed a small percentage of the actual organisms. And then those become much harder to treat. If possible, it's better to use a higher dose of doxycycline, to use 200 milligrams twice a day. Now, in the summertime, that's tough because you get sun sensitivity, and you can get very severely burned from having doxycycline in the skin in the summertime. But it's really advisable to do at least 2 antibiotics. Now, that's for what most people will get from their doctor if they can talk their doctor into it. But you can also go to 2 websites to try to help find a doctor that can treat you. One of them is ilads.org, ILADS.org, which is the International Lyme and Associated Diseases Society. The other one is LymeDiseaseAssociation.org, LymeDiseaseAssociation.org. They can give you a lot of information about, deal with tick bites, how to keep yourself from getting tick bites, how to protect yourself in your yard, how to protect yourself with clothing when you go out into areas that are full of ticks, and can also, help you find a treating doctor, a doctor who's called, quote, Lyme literate, who knows how to treat these infections near you. For myself in my own practice, I tend to use herbal antimicrobials, and these are individually chosen depending upon each patient's symptoms. So I can't really make generalized recommendations. But there are many times I also use allopathic antibiotics, especially in acute cases where somebody has a fresh infection and they're acutely ill.
Okay, sounds like the early treatment is critical before,
Yes, it is.
to prevent the illness developing to deep organs and all that. And so I think this is a very important information because a lot of doctors today, they don't recognize the importance of treating the Lyme disease. So not only with sufficient amount of dosage and a combination of medications, but also long enough, like 4 to 6 weeks that you're doing.
Correct.
Yeah.
So, if untreated, what happens is these very complex infections and these complex organisms, get very deeply seated in the body and in the central nervous system of the brain. And you can get a lot of chronic degenerative diseases, as I said, like arthritis or autoimmune disease, chronic fatigue, fibromyalgia, dementia, and others. The immune system in these people becomes dysfunctional and confused. And it not only allows for the persistence of the tick-borne infections, but also allows for the resurgence or the resurfacing of previously acquired community infections that we all get, like Epstein-Barr virus, which is mononucleosis, herpes viruses like the cold sores, mycoplasma infections, a lot of things that we all are exposed to in our life, and we normally, are able to lock away and keep under lock and key, come out to play again because of the damage to our immune system function. And the other thing that most doctors don't have a real understanding is that the symptoms of chronic Lyme disease can very often be neurological and psychiatric. For instance, a child may get a tick bite when they're 5 years old, and all of a sudden at the age of 11, they start to develop an anxiety disorder or obsessive compulsive disorder or something like that. And people would never connect it to the tick bite that they had when they were 5. So they can happen, months to years after the bite. And things that will clue you in that there could be a possibility would be if there is indeed any history of tick bite. That always makes you very suspicious because remember, less than half of the people even remember a tick bite. There's a deterioration in mental function. All of a sudden, children don't do their schoolwork well anymore. They lose IQ points. People don't do well at work anymore. They can't concentrate. They can't attend. They become diagnosed with ADD or ADHD. People have trouble remembering words or names. They can't remember what they walked into a room for to get. They can't understand what they read. They lose math skills. They lose musical skills. They use sports skills. They get all kinds of headaches. They become sensitive to noise, light, odors, touch. They develop problems with their balance and coordination. They can develop all kinds of movement disorders and ticks are like a motion or a repetitive movement that is not voluntary, it's involuntary. You can have all kinds of problems with your eyes, where your eyes don't track and read right, and you're skipping words or skipping lines. And you can even get problems with nerve roots that are infected and then have horrible, painful problems down a nerve root, like it's called Bainwarth syndrome. It's been known for a long time in the European literature. Again, you can have Bell's palsy, but you can also have a problem with the eye nerve, the optic nerve, and have what we call optic neuritis, and your vision can be affected. You can have hearing problems, the eighth cranial nerve. You can have swallowing difficulties, and you can even develop seizure problems. The most common psychiatric symptoms are uncharacteristic behavior outbursts, mood swings, irritability, emotional lability. Somebody starts to get teary for no reason, or for a situation that wouldn't necessarily make somebody cry. They can withdraw socially. They can have decreased participation in activities because they, just are dull. They just are cognitively compromised. They can be depressed, suicidal thoughts. Suicide is not uncommon in patients with untreated chronic tick-borne disease. Rage and anger management problems and anxiety and panic attacks are actually quite common in this group. That feeling of depersonalization, not being able to tolerate frustration, not being able to tolerate losing, having to always be in control, obsessive compulsive disorders. I've even had patients have all kinds of hallucinations, personality changes, psychosis, and even self-mutilating behaviors. So these are all psychiatric symptoms that, if they're new onset of an anxiety and panic disorder in a 50-year-old man who has no history of any kind of psychiatric illness, is a tick-borne disease until proven otherwise. And then the patient I'm thinking of, it was Babesia as well as Borrelia. Children and adolescents who have these rage and these, anger and anxiety and panic and self-mutilating behaviors almost all have had Bartonella in addition to other infections. So these symptoms can really give you a clue.
When people have been infected and some of them will never become chronic and some of them will become chronic. So what made a difference? What kind of factors involved that make some group of people more vulnerable to become chronic than others?
That's exactly correct. That's an excellent question. About a quarter of the people who get Lyme become chronically ill. About a quarter of the population of the world tends to develop chronic illness when they're exposed to certain biological toxins that can come from the Borrelia, the Babesia, we think the Bartonella, as well as things like mold that's growing in their homes or in their offices, okay? These are the people that have a genetic predisposition to have a state of inflammation chronically when they have these kinds of infections and toxic exposures. These are the quarter of the population of the world that tend to have problems. You're right, there's some people who get a tick bite, they get sick, you sprinkle a little antibiotics on them and they perk right up and they're fine and they don't develop any problems, where others would get very chronically ill. And I believe it also, in addition to their genetic makeup, has to do with the epigenetic factors, or the factors that control how their genetics is expressed. These can include their nutritional status, their emotional status, their history of physical or psychiatric trauma, as well as other toxins that are involved. For instance, heavy metal toxicity from a mouthful of metal amalgams, or growing up in a house with lead-based heat, or eating a lot of food that's contaminated with cadmium or other things. Also, people who tend to ingest a lot of the environmental toxin glyphosate, which is the main ingredient in Roundup, which is used in so freely in this country in our agriculture. All of our processed foods and our wheat is sprayed with it. Oats are sprayed with it. A lot of the corn and the soybean has it. It's Roundup ready. It's already got those chemicals in the plant and genetically modified plants. So a lot of people ingest that in their diet, in their air, in their water. It's ubiquitous now. So these other factors can contribute to someone getting more chronically ill than others. So it's really, your genetics as well as your lifestyle, your life experiences, your diet, your emotional situation. Someone who has a history of emotional, physical, or sexual abuse is going to be much more prone to develop chronic problems than someone who hasn't had any kind of those problems. So yes, there are many factors that contribute to why some people get sick and others don't.
Not only the infection of a Lyme and the co-infections of Lyme disease, there seem to be other types of bacteria, virus, even vaccines that can generate similar symptoms like chronic Lyme disease in certain population. What would be your comment on that?
Well, that's part of the differential diagnosis workup when you see a new patient that you suspect has Lyme. Just because it walks, talks, and squawks like it's Lyme disease doesn't mean it is Lyme disease. You need to also do a good medical workup to make sure that you're finding all of the problems that the patient may have. You could have autoimmune disease. You could have autoimmune thyroid disease. You could have intoxicants like heavy metals that are problematic, or as I said, the environmental toxins. You could have mold exposure, and you need to check for that. So yes, there are other infections, community-acquired infections. Epstein-Barr is a big one. Problem is that many of these things coexist in the same patient. So another problem that people have is they tend to get hypercoagulable, meaning that their blood is too thick and sticky and like molasses rather than water, and it tends to clot. And there are many reasons that this happens, but chronic infection and toxicity is one of them. So these patients who are chronically ill usually have multiple factors that you have to address not just the infections. And a lot of the people that come to me over the years have seen other Lyme literate doctors who have just focused on the infections and just treated the infections over and over and over again with antibiotics and didn't deal with the fact, that the patient's got a mouthful of metal amalgams and is mercury toxic, or the patient is living in a moldy house, or the patient has, serious gut dysbiosis, which is abnormal growth of bad bacteria in the gut that has to be dealt with, or they're horribly hypercoagulable and you need to deal with that because they may have a genetic predisposition to develop hypercoagulability when they're stressed. So there are many factors that create that common problem of the chronic disease. And yes, you could say, well, this symptom and this symptom are characteristic of this particular infectious organism, but it's also characteristic of this other one. And it's also characteristic of this kind of toxicity. So that's why you have to really evaluate these patients very carefully and go through all of those variables and try to address all those variables at once. It's kind of like, peeling an onion. You've got to slowly get down to the core where it's fresh. And every once in a while, you'll find a rotten spot and you got to work there for a while to clean that up. And it's, going down deep into the body and pulling these trapped toxins and infections up out of the body and bringing them to the surface so you can clear them. And that's kind of it's the art and it's the fun of it.
It also sounds a very long process of healing to accomplish all that. How do you help patients to being the patient and to follow through the treatments? And I know in the process of treatments, they can have a lot of fluctuations of symptoms. Sometimes they get worse before they get better.
Yeah, well, the more experience I have with it, the less bumpy that road is. And if people are compliant with what I ask them to do, if they are compliant with the lifestyle changes that they need to make, meaning they've got to clean up their diet, they need to get out of mold or remediate where they are so that it's clear of mold, and they need to do different lifestyle changes and stop drinking alcohol, stop smoking cigarettes, get good sleep, again, eat a really healthy diet. If they do all these things and they follow their protocols as prescribed, then really sick people can really be a whole lot better in about 18 months. They may not be done, but they're significantly better. And it's my job to teach patients what they need to do to keep themselves healthy once they've gotten there. So I use a whole, combination of herbal antimicrobials and herbal combination medicines to help, clean up their organ function, to reduce inflammation, to treat their hypercoagulability, to detoxify their liver to help with their kidney and lymphatic function, to help their endocrine problems, their brain fog. So as you do all these things all at once, then people can really get a whole lot better. But I always tell my folks, you've got your own responsibilities and I've got my responsibilities, and we'll walk the road together. I'm not going to pull you along, but because, you've got responsibilities. So if you're able to do that, then we'll get you better.
Well, you do sometimes refer patients for acupuncture treatments. And what is your thoughts on that? Why do you do that?
Because I think that acupuncture can be extremely helpful in chronically ill Lyme patients, because it helps to restore vitality. It helps to clear blocked energy channels. It facilitates immune system function. It helps to regulate the organs and help the organs clean themselves. And it really helps to remove the pathogens, find where the trapped pathogens are and remove them. And the Chinese herbal formulas that are often used in conjunction with acupuncture are, the concept of them is similar to what I do with the remedies that I've learned how to use in my own healing. Some of them come from the Chinese tradition, some come from the European tradition, some from the Polynesian tradition, some from the South American tradition. So I've learned how to use a combination of things that work in a similar way. They help to replete vital energy. They help to reinstate communication throughout the body. They help with the elimination of toxins. They reduce immune system confusion and aid in the destruction of pathogens, in an attempt to restore balance to all of the systems of the body. Once you restore balance and get out of the body's way, the body heals itself, because we have this incredibly divinely inspired, vessel that we live in for this life, which has an incredible ability to heal itself. We just sort of have to help it and nudge it along the way and then get out of the way and watch it go.